Brad, you've seen decades of healthcare fights. The Clinton administration, which you served in, famously attempted to reform the healthcare industry and failed. What do you make of the process by which this was passed?
Well, this is something I don't think I've ever seen before. This is a bill passed by the House of Representatives only after the promises by the House leadership to the key members that this bill would never be seen again, that the Senate would throw away and start over with its own bill from scratch. And so the fact that there were large parts of this bill that they did not like simply did not matter at all.
Okay, so the Senate will take up its own version of the bill. That's certainly one part of the effort here. But it was a political victory of sorts because they get to go home and tout to other constituents during the recess, hey, we got this done. And it allows them to move the ball forward on some other initiatives, perhaps things they care about, like tax reform.
It's not clear whether it's a political victory for them or not, because they will be able to tell their base that, yes, we repealed Obamacare, but how many times has the House voted out a bill repealing Obamacare so far? Isn't this number 17 or so, the times that they voted to kill Obamacare? And Keith Hall, the director of the Congressional Budget Office, the person whom Mitch McConnell and John Boehner chose to be their keeper of the economic and budgetary effects of the laws, Keith Hall is going to come out fairly soon saying, oh, and by the way, this AHCA is going to reduce the number of people with health insurance in the country by 25 million or so. And that's a difficult thing to have to explain during a recess. So I'm puzzled as to why they did it. Why they didn't let the Senate go first and then take up whatever bill comes out of the Senate in the House. Why the House insisted it had to start this off.
Some people are also puzzled, Brad, about why they didn't do tax reform first. Is there a risk here when the Congressional Budget Office looks at this and does the costing? It actually costs the administration in terms of what they can achieve going forward on tax reform because they can't get away with so many tax cuts financially.
Well, this bill is... It's hard to talk about this as a bill when it's passed with promises that it will never be seen again in the Senate and will never come back to the House. It's much more an exercise in, call it dingbat kabuki, in purely symbolic politics that's not supposed to affect any of the flows of spending or any of the laws through the U.S. government. So that makes it hard to talk about. But if we are going to talk about, it is paid for. It does reduce taxes on rich people by $600 billion over the next decade, and it does do that by taking $600 billion that were going to flow into the state federal Medicaid program by taking those $600 billion away from the states. So it doesn't have a net budgetary impact over the next decade, or it wouldn't have if it were to become law, which it won't, if it were to be taken up by the Senate, which it won't be, if it were to come back to the House, which it isn't.
Look, anything this big and important as healthcare in the United States needs a deal that attracts bipartisanship. And unfortunately, Obamacare didn't do that. What's the solution here? What's the deal that this government can reach with the Democrats that finds that?
I don't know if there is one. Right? That, as Larry Summers said, the interesting thing about Obamacare is that it is the most conservative plan you can propose that still has a chance of getting us to a situation in which everybody or almost everybody has health insurance. You want to go more conservative than this, then you give up the goal of making health insurance general in this country. That you wind up saying, well, yes, we're going to have 30 million people who don't have health insurance and 30 million people who are scared to go to the doctor because they don't know how much they'll have to pay. And we'll have very lousy health statistics compared to other developed countries as a result of it. That our health statistics in aggregate say that we're about as healthy a country as a place like Costa Rica, which is much, much poorer than we are. And if you want to do anything other than Obamacare, you have to go further left, which is why my friend David Cutler was saying yesterday that this vote is actually the first vote for single payer. Because if Obamacare is going to be rejected, And as long as we think everybody ought to be able to get health insurance, then something like single payer is going to be the only way to go.